but the problem is still going to be the same. If you don't take a sample of the tissue that the Lyme is hiding out in, then the culture is going to be negative. So that's part of why conventional doctors, the Infectious Disease Society of America, okay, has such a very difficult time saying someone has chronic Lyme. You know, you received appropriate antibiotics. You received them for 10 days to 21 days for what we thought was Lyme. Your test may or may not have been positive. And now you're complaining 6 months to a year later, and you think you have chronic Lyme, okay? They don't believe that there's any connection between that original infection and subsequent symptoms. And ILADS, the International Lyme and Associated Disease Society, that basically grew out of the trenches. These were physicians who were up in New York, up in New Jersey, up in the Northeast primarily, where we first started seeing Lyme, who saw patients coming in and they couldn't explain what the patients had. And so they grew up in the trenches with these patients who were begging for, do something. You know, I'm losing my life. I can't do my job. My brain doesn't work anymore. I hurt all the time. I can't sleep. I don't have any energy. And so the CDC very wisely said the diagnosis of Lyme disease is a clinical diagnosis. It's not based on a blood test. All right, so it is a clinical diagnosis. And the Infectious Disease Society prefers to lean more on the blood testing. Does that make sense? Mm-hmm. Is this of interest to you? Am I hitting about this is what you want to hear? Okay. This is the article that it was a natural triad, and probably all of y'all hopefully read it. I'm not going to go through the whole article, but I am because it helps remind me of things that I want to say. The thing that I think is most important, and the reason I'm going to use it as a reference is because there are a lot of things that I said in this article, and there are a lot of things that I didn't say. It used to be, and I don't know if this is still true or not, it used to be that if you went to Duke and said, I have chronic Lyme, or if you went to UNC Chapel Hill and said, I have chronic Lyme, they would not accept you as a patient because there was no Lyme disease in North Carolina.
They don't.
Yeah.
It takes off, I think, in the state lines.
What a concept. And I dared to disagree with him because I was seeing patients who lived in North Carolina who clearly had Lyme disease and patients who had chronic Lyme. And I had been to some ILADS conferences and learned a lot about it. And this showed, I said, Guilford County is one of those areas that's considered endemic with Lyme disease because we had 2 cases each year, and those are cases that fit the CDC criteria. So these are the ones that even the Infectious Disease Society of America would agree, yes, these were Lyme cases. But they still don't think that they are endemic to North Carolina. Okay, they'll still argue that. They'll say, well, they traveled out of state, so they picked it up someplace else. It's not really here. Now, if you talk to vets, how many of you know vets? How many of your animals have Lyme? Okay, pets all over North Carolina are getting Lyme and being treated for it by their vets. So I don't think the ticks care if you're furry or not. If you're available, they're going to bite you. So there is Lyme in North Carolina. All right, without any question. Say what?
And Guilford County.
And in Guilford County. Oh yeah. Let me see if there's anything here.
The adjoining county in Virginia where Tammy and Trish lives in Grayson County.
Uh-huh.
So that's where they live and they've got
One next to Allegheny, and it's one listed.
Yeah. I mean, it probably is going to follow the same distribution as Rocky Mountain Spotted Fever did. Okay, it follows where the deer are and where the buffalo are. Okay, where the buffalo used to be. So if you follow that, that's where you see most of the Lyme. Okay, at least it used to be that way. Acute Lyme disease, if you get a bullseye rash, say your prayers and say thank you. Because that's an automatic, you have Lyme disease, you get reported to the CDC. You don't even need a blood test that's positive. If you get the typical bullseye rash, and you know that you had a tick bite, that's a home run. You get treated. Now, I don't think you get treated for long enough. And the difference between what the Infectious Disease Society says versus ILAD say is that the Infectious Disease Society says 10 to 20 days of an appropriate antibiotic is enough. Period, end of story. All right. The ILADS says now somewhere between 4 and 6 weeks, sometimes even 8 weeks, depending upon the patient's health, because the Lyme can be so aggressive, and you have to hit it really, really hard. And they find that if you do not take the antibiotics for long enough, frequently the Lyme will build up resistance against some of the antibiotics.
And that bullseye has to be red. I had it big purple.
You know, I don't know, quite honestly. And people are different. So hopefully, if you had a bullseye rash, even if it was a little purplish,
It
then
wasn't a little,
it was a lot purplish.
Yeah.
Okay. Hopefully, did someone go ahead and treat you for Lyme
No.
when they saw that? Oh. Too bad. Yeah. And
testing back negative.
yeah, but if you get the bullseye rash, that's really good because you should get treated without a whole lot of hassle. But if you don't get treated for long enough, then you're still at risk of the Lyme coming back, unfortunately. Probably the drug of choice, if you do have a bullseye rash, is going to be doxycycline. You know, amoxicillin is also a drug that will work specifically for Lyme, but the problem is ticks are not clean animals, so that it's more likely that you're going to get several different germs as opposed to just Lyme disease itself. Now, one of the things I said here was it is delivered by ticks. Okay, I chose not to say that, oh, it's delivered by insects too. They're saying now that it's delivered by fleas also. Oh, you can catch it sexually. It's a spirochete. It's like syphilis. Okay? And people have documented this across the country. Now, I decided not to say that in our small town, but there are other ways of getting it, so you don't have to just get a tick bite. You can get it other ways. Now, how easily is it spread sexually? Okay, I don't know. All right, clearly not as easily as HIV or herpes or something like that, but there is potential for that. And people have also documented that it goes to babies. Okay, it goes across the placenta. This is a spirochete. It can do everything that syphilis does, and syphilis does all of those things. Does that make sense? Okay. Come on, give me an arrowhead. All right. After the acute phase, like I said, ILADS basically recognizes that you can develop chronic Lyme. And unfortunately even there, the blood test may be negative. The best test that we have to offer people at this time is a Western blot test performed by IGenix Lab out in California. They're the state-of-the-art place to get your Lyme testing. But I can tell you right now that very, very commonly, I'll get people that I really think have Lyme, and the Western blot's still negative. And that's usually because their immune system is so profoundly compromised, they can't make the antibodies against the Lyme germ. Does that make sense? So
What do you mean compromised?
the immune system is so squashed down, okay? And many times what you'll see have people had Western blot tests? Yes, okay, all right. So you'll have a Western blot, and very commonly what you'll see is that you'll have several of the IgMs will be positive, and very few of the IgGs will be positive. And that's typically what we see in people who have chronic Lyme. Now, that's not gonna win you a reportable case. Your ELISA probably is gonna be negative, and you have to have ELISA positive and IgM positive and IgG positive on the Western blot to be a reportable case to the CDC. But very commonly, the Lyme disease, the Lyme organism, compromises your ability to make the IgG antibodies, which are the more specific antibodies to take down that Lyme. Lyme is very smart, and the way that it stays in your body is that it damages your ability to make those IgG antibodies. So the only response you have is an IgM antibody, and an IgM antibody is like it's like the local police. When what you really need with Lyme is a very specialized search and destroy mission, which is what the IgG offers you, and your body never is able to make those antibodies to get rid of the Lyme. Does that make sense? Okay, so it squashes your body's ability to detect it and to be able to take it out. Yes.
Since you're talking about testing, can you talk a little bit about the CD57 blood test, and do you think it's a good indicator of chronic Lyme?
Okay, so she's asking about a very specific test that is used, okay, to try to assess it doesn't tell you if someone has Lyme, okay, it's called a CD57, and it's a particular lymphocyte cell line, all right, and if it is low, it's suggestive of the individual has Lyme. It doesn't prove it.
Suggested.
Okay, it's suggestive. All right. It also says this is a sick pup. If your CD57 is low, you know this person is profoundly sick. Okay? But you can't say absolutely it's due to Lyme.
What other things can cause a low CD57?
A number of other chronic infections. Yeah. And again, we don't, actually the vet school at State is able to culture Bartonella. They mainly do it in animals, but they also do it in vets. And so they're beginning to culture that and work out how do you culture Bartonella. We don't have a good way of culturing Babesia yet, okay? So there are lots of, and the problem is there's usually more than one infection. Okay. After the acute phase, if you get enough antibiotics, hopefully you won't get chronic Lyme. Your body will take care of it. Yes.
Prednisone or any steroid would also give you a false negative, right? Because that's suppressing your immune system.
That suppresses the immune system in a different way. Okay. And I can't tell you that will automatically give you a false negative. I can't tell you that. Okay. But that also compromises your immune system. Now, if you don't get over it, there's some people, there are bound to be people out there who get bitten by ticks and get exposed to Lyme disease, and they never get sick. So, they've got better genes, they have better nutrition, they have a lower heavy metal load, they are less stressed out, their hormones are better balanced, they have adrenal reserve, they haven't been exposed to fungus, to mold, they don't have any kind of mycotoxins or things like that in their system, all right? But if you have any of those things, if you do not have good nutrition, that increases your risk of getting chronic Lyme. If you have mercury in your system, that increases your risk of getting chronic Lyme because mercury dampens down your immune system the same way Lyme does to a certain degree. Mycotoxins, mold, dampens down your immune system the exact same way Lyme does, so that you have a much greater risk of getting chronic Lyme disease. So the more unhealthier you are when Lyme is introduced into your body, the greater the chance you are going to develop chronic Lyme unless you get somewhere between 4 and 8 weeks of antibiotics right after exposure. The other thing that I think is really interesting is that you don't always have to have the bullseye rash right where you get the bite. You usually think, okay, got bitten here, bullseye rash is right there. All right, that's what everybody expects. what happens, I've had a couple of patients come in and, you know, they got bitten up here and they pulled the tick off, but they got the bullseye rash down here, and so they were told at the emergency room, you can't have Lyme. The tick was up here. This is some other rash. Wrong. That person already had Lyme. They already had it. They didn't have any really bad symptoms from it, but it was still in their system. Their body had basically contained it, but then when they got re-exposed, they got the rash someplace else. So that's a huge red flag that this person has already been exposed to Lyme and needs to be treated probably for 6 to 8 weeks with antibiotics. Is that helpful? And I said, I don't know if I said it on my article, I know I said it on Fox 8, and I was incorrect. And if y'all write your names, did something circle around so that you could write your names down? Cool, okay. Okay, I said that this part is accurate. If you get bitten by a tick, okay, you want to pull it off of yourself safely, and then you want to freeze it. You put it in a plastic bag and put a date on the plastic bag, and then put it in your freezer. All right, and then if you develop symptoms, okay, you can take that to the hospital with you, and it can be tested. What I said was that the CDC did testing, and they no longer do testing. I thought that they did, but they don't. And in fact, just today, I got invited to become part of the tick. There's going to be a tick kit that is sold that people can buy and send their ticks in to a particular lab and get the ticks tested. Also, you can ask physicians in town if that happens, and we can send it. Some of the health departments do it. Now, I know that the North Carolina Health Department, on a state level, knows that there's Lyme here. Are you going to get someone to process it at our local health department? I'd love for someone to try that.